Good morning, good morning. Good morning, everybody. Hey guys, Dr. Stavros here, Step 1 Prep. It's Tuesday, October 21st. Just had my morning live session with my medical students and physicians. So yeah, I just wanted to share some amazing information. You know, when we cover Step 1 Prep, most of you have followed me, seen me for so long, for over a decade now, with step 1, step 2, step 3, step 2 CS, a lot of stuff, right? So there's many resources out there. There's many people saying the similar stuff, similar things. There's always advice. There's always information. There's always different ways. Good morning. Good morning. Different ways to conquer this exam. I personally hacked the system. I know it has to be done. So when students follow me, whether you watch TikTok, YouTube, Instagram, Facebook, live, or jump on my live sessions weekly, I show you how to pass the test. You know, I don't like the exam personally. I think this exam is challenging because you're taking all of basic sciences, right? 2 years and cramming it into an exam, 8 hours, 7 blocks of 40. So many students are taking it in America, Caribbean, a lot of universities in Europe are implementing the USMLE exam as part of their curriculum to pass the semesters to move on. So we're getting an influx of students from all over the world and doctors alike. However, this exam is challenging. So when you hear me talk about points and points and points, I can't teach you 2 years of medicine. I don't have the time, nor do I want to. You go to school for that reason, right? Yasu yatra, Greek, my friend, my doctor in Greece. So it's important to understand that this exam is challenging because you have to learn how to play the game, right? Anyone can tell you Amboss, UWorld, right? QBanks, read the first aid. Well, just like if I ask you how to run a marathon, well, you have to exercise, you have to work out, you have to eat healthy, you have to run. Yeah, but I need more guidance, right? Same thing. So a lot of students reach out and they work with me because they need that guidance. A lot of my medical students and physicians have access to my either study plan for 2 months or 3 months. Everyone has the same resources. The secret is, how do you use it, right? How well can you use it? So that's why I take pride in my coaching with my students. My big thing that we're doing is the question library, the QBank library videos, because I know all of you. And again, some of you are watching this and not in medicine, just here for supporting, and I appreciate it. But all of you who are studying or know someone that studies for the boards, they have a question bank. Yeah, they have a first aid. Okay. Now, whether they have time or not, it's up to them, right? Some people are in med school, some people are physicians practicing, other people are getting back into the rhythm. They're working, have they're 2, 3 jobs, they have kids. So it's challenging. It's very, very challenging, and it's very, very difficult. So what I decided was, well, if everyone that I know who's studying has a QBank and everybody has a first aid, why aren't they passing? Well, it's because we have different knowledge gaps, right? Some students are more stronger in biochem, in cardiology. Other doctors are just better test takers. So I narrowed it down to two things. It's either content or test taking. Very simple. So whatever you get from this, just get that if you're studying and you're not doing well in questions, well, it's either you don't know the material or you're just not a good test taker, right? Or both. Just like if you go to the hospital, and I tell my students, if you go to the hospital right now and you go see students, if you go see patients, and you don't know what classifies as chest pain, what differentials can cause chest pain, well, how can you diagnose the patient, right? Very nice, Yetra, very nice. Yeah, I mean, steps are big. Steps are big. Everyone's doing steps, USMLE. So that's the whole point. And that's why I chose to create the question bank video library to basically say, okay, I have students who have a QBank, Amboss, UWorld. You know my feelings, you know my love. I love both, but Amboss is better at the beginning, UWorld is better at the end when you're studying. So you have your QBank and you have your first aid. So why aren't you passing? Why aren't you doing well? So that's why I come in with these videos. I use Amboss questions and I dissect them so I can show you how to read these scenarios, right? How to dissect this information, show you a different style of questions they use, and also teach you something too. Because if you have 5, 6, 7 answer choices and you can't tell yourself or you don't know what these mean, that's a problem. So today we did behavioral science with my students, right? We went over antipsychotics, typical and atypical antipsychotics. So FARM, as you realize, if you follow me, FARM equals points. So if you can't tell me which ones are typical versus atypical, well, that's a problem. Which ones can cause agranulocytosis? Well, that's a problem too. It's clozapine, right? So you have to know not only buying a Q bank works, not only buying first aid works, but how are you going to do it together? And there's nothing out there that's going to help you besides my Q bank videos, because I haven't seen anything. You know, I see people talking about how to teach you cardiomyopathies in 5 minutes. Yeah, that's great. So you know which ones are which. You know which murmurs are systolic versus diastolic. So answer me a question. Why are you still getting the questions wrong? So that's why, you know, my sessions weekly, we jump on live twice a week on my closed circuit with my doctors and my members. Now I'm just jumping on live to share some information with you. And knowing that I'm always available, my team 24/7, we're always available through social media, through emails, support@USMLEtrainings.com. But some information to provide you guys. Joseph, my friend from Italy, how are you? Good to see you. Some information to provide you before I go. If you're studying for step 1, you know, don't take NBMEs unless you have to. Now, I get a lot of hate mail on this, but I'm the pioneer of USMLE. USMLE, you do not need to take NBMEs. NBMEs are only provided and taken because med schools make you take them, right? Okay, that's fair. But think of it this way. If you're studying for you with UWorld and AMBOSS, the questions are very, very long. Yes, yes. So how do you go from reading a question this big to then when you take NBMEs, they're this big? It's a different question style, question stem structure, right? So because of that, people are doing well in AMBOSS and UWorld, awesome. And then they fail NBMEs because the questions are really short. You have to decode the question. So if you are one of those students in America and the Caribbean who have to take the NBMEs, a quick little advice, get your hands on old NBMEs offline, the old ones that are retired, practice the style of questions so you can be comfortable on reading the style of questions they use, and then take the NBME and pass to allow the school to sponsor you. For those of you watching now and later who do not have to take the NBME, a little advice to you: if you have UWorld, do the 2 UWorld self-assessments. So that's 2 self-assessments, and then do the old and the new free 120. So altogether, you have 4 assessments. If you're scoring 65 plus on all 4, you should have the green light to take the test and pass. Dr. Joseph, ask a question, man. You can ask a question here. If not, you can email me. You can hit me on social media. You can email me support@USMLE. Yeah, I'll put it right here. Support@USMLEtrainings.com. Again, in order for you to pass a test like this, you need to be guided by the best people who know how to pass a test. You know, if you want to learn medicine, if you want to relearn basic science foundation for medicine, there's online med ed, there's boards and beyond, there's boot camp. I love them all. If you are out of the studying, if you've been, let's say, out of med school for a while, you should go back and watch those types of videos to help you relearn and recall all the basic science information. Those are amazing videos that I recommend. If you are in med school now, you're like, you know what, I'm doing well, I know my medicine. There's a dog running out there after a squirrel. If you're in med school and you know your medicine, but you're having difficulties connecting, right? I know the info. I knew it was cardiomyopathy. I just didn't know which one it was. I knew it was hypertrophic cardiomyopathy. I knew it was HOCM, but I just didn't know about preload and afterload and about Valsalva maneuver or, you know, hand gripping. Well, that's a combination of recall and reading the questions a certain way. That's where my videos come in, right? The QBank video library. So a lot of my students are using those videos each and every day. They have me accessible 24/7. And that's nice because, I mean, I would love to be with you guys each and every day, all day long. So my team is working hard to improve, increase the number, improve by increasing the number of videos in my library and allowing all of you accessibility to questions. So if you're watching here, guys, do me a quick favor. Let me know where you're at. You know, I'm from New York. Right now, I'm in Wisconsin. Love to see where you guys are at worldwide. Most of my doctors that I work with not only are from America, but they're overseas, Europe, India, Asia, South America, Africa. So I work with doctors everywhere. So I'll be jumping on these live sessions more frequently throughout the week. So you could ask me questions here. You could reach out to me and ask me questions in my social media. My team will forward all the information to me. All you got to do is type QBank, and you can get easy access to my online step 1 QBank videos. Again, I'm here to change the way people are studying. You know, I know a lot of us, I'm old school, you know, so I study with textbooks. Back then we'd have to memorize. Nowadays, everyone is the attention span is gone. So everyone's swipe, watching videos quickly. I got to learn everything. Unfortunately, it doesn't work that way. But what I do well is the videos that I create. Not only am I teaching you how to read the question stems, right? How to analyze what information they provide and how to dissect the scenario the right way, but I'm also teaching you how to read the answer choices. You know, why is it very common for students asking me, I don't know how to answer questions. I don't know how to read the answer choices. How do I read the incorrects? How do I manage my time efficiently? So I gave you a lot of information earlier of how to plan your day as far as studying, whether it's a QBank or first aid. Study plans, I have 2 months or 3 month study plans. Point is, you need a QBank, you need first aid, you need me. Put it all together and move on and move forward. Step by step, day by day. People are texting me from left and right. So Brazil, very nice. Houston, awesome. You know, I got people right now in California. And what the nice thing is, even though pandemic is over and obviously we're back to business and work and traveling and shaking hands and kissing cheeks and all that, the issue is when you're studying for an exam like this, step 1, step 2, NBME, if you're not in school, you're alone, right? And if you're a pioneer, most of my students from Brazil, South America, Europe, their colleagues are not studying for USMLE. So they're by themselves, right? So besides having me, because they're on my team, we have the online physician community, which, you know, we have a beautiful platform and students and physicians communicate through there. All my communication is going through there as far as my weekly posts, my daily posts. When we have our live sessions with my step 1 class, we record it and archive it, so you guys have access to that. The nice thing is, whether you're from Brazil, Greece, Argentina, Japan, you know, South Africa, you know that 24/7, you're going to have access to everyone in the same group. So we're always supporting each other, because I don't know about you, when I was a student, we didn't have the technology that you guys have now. So we only had our colleagues who were ahead of us in med school to help us, our seniors, and we didn't have the social media clearly, or the technology. I was there 15 years ago. So you guys have no excuse now. You guys have a lot of ways to communicate, a lot of ways to stay in sync, to work together side by side, day in and day out, you know? All right, so we have a question here. Do you think it's easier to pass step 2 first and then step 1? So the question, Dr. Gomez, do you think it's easier to pass step 2 first and then step 1? Great question. I would say yes and no. First of all, ideally step 1 is first, then step 2. Yes, yes. Let's just say that's fair. However, ideally, a lot of doctors who are practicing are in the hospitals working, and they go, well, my clinical knowledge is stronger. So in that instance, what I recommend some doctors to do is they can start with step 2, because they know more about the medication, the management and everything. They pass it, they get going, they feel good, and then they have one less thing to worry about, and they jump into step 1. Because remember, step 1 is a lot of basic science medicine, right? It's a pathogenesis, the MOAs, little stupid details, embryology that you never see in medicine ever once you start practicing. So to answer your question, Doc, I would suggest if you have finished medicine and you're getting back in and you're trying to get into the States for the residency, try to step 2. I mean, you could do sample questions. You know, there's internal medicine and all the specialties, peds and OB-GYN and surge. The issue with step 2, be careful, longer scenarios, more answer choices. Instead of 8 hours, it's 9 hours. Instead of blocks of 7, it's 8 blocks of 40, right? So I would recommend taking step 2. At least you get the ball rolling, because I've seen too many doctors who finish med school, you know, out of the country, and they want to come back. They want to come here to do residency, and they struggle with step 1 so much, 4 months, 5 months, 6 months, 7 months, that they're like, you know what, I'm done. I'm tired. I'm exhausted. And because of that, I tell them, hey, listen, if I knew you earlier, I would have said, focus on step 2, get that out of the way, and then you have the momentum to take step 1. Any doctor I've worked with step 2 first, they're so into the zone, in the zone studying, that all the knowledge they have transitions over to step 1, and they have to study less time. They got to acclimate to the stupid little details, but realistically, I've never had a person ever pass step 2 and fail step 1. You know, it's usually step 1, struggle, fail once or twice, and they give up. All right, man. So keep going, Dr. G. Let me know how it is, bud. You know, you can always reach out to me on social media. It's not AI generated. I always respond, or my team responds, or they send it to me and I respond a little later in time. Dr. M, somebody from YouTube. Good afternoon, Dr. Stavros. My biggest problem is that I do know info from book or video, but this same information presented for the first time in tests. It's like from another planet sometimes. Yeah. So he's saying that he does know the information. The wonderful individual from YouTube watching live. So they know the information, but when you see the questions or taking the tests, it's not the same. It's written differently. And you're 100% right. We all have to understand, all of us here watching, you know, most of you are watching it now. I jumped on because I had my live session, so I had a few moments to spare. Whether you're watching this now live, hi, or whether you're watching this later, all of us, right, have to understand when you go in to take an exam, you have to know what the exam is about. Simple. And MDs and PhDs are employed to create questions for the USMLE organization. And it's not like any other question that you have ever seen before. I'm sorry, it's true. So when you said that, I agree with you. It makes us all feel stupid. It makes us all feel like, well, what are we doing? We're studying. I'm working hard. I know about iron deficiency. I know about, you know, cystic fibrosis. I know about, you know, hemoglobin. I know about this. I know what the information is. But when you read the questions, you're like, what is this? The questions are meant to be tricky at times. The questions are meant not so much for you to read and know the answer right away. The questions are meant to be like, okay, sometimes they're first order questions, you know, very simple. Some of them, they present the symptoms and you have to connect to get the answer. Other times you have to have enough knowledge in the answer choices to eliminate all the answers that they give you so you come up with the right answer. Other times they have most common side effects, most common association, biggest risk factor. So that's the tricky part, Doc. And that's why, thank you for the question. Thank you for the statement. That's why I'm not here. I haven't been here just to create the same thing that everybody else does. I know that people are very smart. And I know many physicians that I met who have failed once or twice step 1, and they're about to give up. I meet them, they work with me, or they work with somebody that gives them, you know, obviously good advice. And before you know it, they pass a test and move. So ideally, this exam will make you feel confused at times because you're like, well, I know the information about why did I get it wrong? So please, whoever's watching this now, all you have to do is this. You just literally have to read the answer choice and say, okay, what was the issue with the question stem? Why did I choose A versus B? And then start realizing that there's a certain method behind everything. So that's why we work really hard, my team and I, to create all these question bank videos, because ideally everyone needs to be navigated. Because honestly, guys, I used to feel the same way 15 years ago. We do URL stuff, you know, we do URL and Kaplan, and we would do well, and then we do really poor. and then we would do well and we feel stupid. It's like, well, man, we know the information. So I don't want you guys to struggle. I want you guys to do this. Use UWorld or Amboss. I prefer Amboss over UWorld at the beginning. It has a lot more tools in the software to help you understand and analyze everything. But I know there's a UWorld family out there. They're amazing QBank, but a lot of people love UWorld because of the name. But if you're using a QBank and you're struggling and you're not scoring well after 4 or 5 months, well, guys, you got to figure out what the problem is, right? It's either you don't know the material, or like this doctor on YouTube knows the material, but when I read the stupid question, it's from a different planet. The more questions you do, the more you'll understand the mechanisms behind the question stems. I would say, because I'm getting questions now, I would say quality over quantity. Do less at the beginning, but assess why the answer is the answer, why the other ones are incorrect. Build your foundation, yeah? And then later, as you get better, and eventually Dr. BM from YouTube, you start realizing, I got the rhythm. I understand what they're doing. They're playing games, right? They try to distract you with some answer choices. They throw stuff in the question stem that really make no sense, right? Once you get comfortable with that, then you'll be good to go. And then you rev up the questions, the amount of questions. You start doing 40 questions, 80 questions, 120 questions a day. All right. So you guys should check it out. Honestly, you could type in USMLE trainings. I have so much going on. USMLEtrainings.com. There it is. That's the website. Check it out. Jump on, check out some samples. You can see me on YouTube. Again, I'm always transparent and I'm always available because you guys need to know how to pass this test. I took it. I'm good. All my colleagues, they took it. They're good. Melman QBank. I like Melman. I love his high yield sheets. His question bank I haven't done yet, so I'm not sure, but everything he's done is pretty solid. UWorld obviously is the grandfather of QBank, so you can't go wrong. Again, there's so many resources, and I praise many resources. Melman, great guy, great videos, great, he has high yield PDF sheets, which I think are phenomenal. If you need content, you got to watch Online Med Ed or Boards and Beyond, top two, because they have videos that will help you understand what you should have understood in med school. Remember, med school is 2 years, basic science, and 2 years clinical, right? This information is needed to know. So if you're struggling, all of you here, if you're answering questions and you're struggling on, man, I don't know the material, the more questions you do, it's going to take you longer to learn versus you say, you know what? I said this to my students this morning. If you really want to know how to do things, you do 2 days worth of a system, let's say cardiology. You do 40 questions in the morning for 2 days and assess your answer choices. If you're scoring less than 60% and you don't feel good with the content, please don't move on to another system. Spend a few more days on cardio. But if you, Dave, let's say you do respiratory, right? Pulm, and you do 2 days worth of pulm, you're like, you know what? I'm doing pretty good, scoring 65, 68. I feel good. I know about asthma, about restrictive lung disease, about, I know the medications, I know about the physiology. Why would you spend more time? Move on to the next organ system. So try that. But yeah, Melman, I can't say about the QBank. I would choose UWorld over Melman QBank just because of the timeline and how UWorld's been in the system, in the game for a long time. But if you're using UWorld, gauge your performance, and if it's not working after 4 or 5 months, you jump ship to Amboss. Amboss has a lot of tools, helps you with the diagnosing of the question, helps you with learning why you're getting the question wrong, and you're good to go. All right. So if you guys you follow me online, and I appreciate you, you could jump on my website and you can sign up for newsletters, and I'm always reaching out to my students and my peers of helping you out. We meet students twice a week, every Tuesday and Thursday morning, live on my closed circuit Step 1 group. A lot of people can't jump on the live sessions because they're in med school and they're studying. The biggest thing to get from this is the QBank video library. Reach out to me, jump on the website, USMLEtrainings.com, check it out. YouTube, I have tons of videos. Again, don't get stuck and don't spend 6 months plus and score 50% on your QBanks. There's something wrong there, okay? So I know people are studying, but if you're home all day studying, you should be able to pass this in about 3 to 4 months. But if you're married, have kids in the hospital, if you're obligated 40 hours a week doing something else, clearly the math adds up that you'll spend more time studying, right? But if you're home and you have all time in the world to study, 6 days a week, not 7, you need a day off, 6 days a week for 3 months, if you do the right things and use the right resources, I promise you, there's no way you should be spending more than 4 months on this. The longer you take, the more stress you're gonna get. And I don't know about you, I'd get tired, man. It's already October 21st. Next thing you know, seasonal depression kicks in, days get shorter, holidays are around the corner. So reach out to me if you need help, hit me up. QBank, you type in QBank, you can get everything sent to you. Just go to my website if you need it. Hit me up with the social media. I'm always available. My team's always there 24/7. There's no excuse. I need you to pass. We need more doctors in our healthcare system. All right. Be safe. Stay safe. Let me know how everything goes. Dr. G, good luck with step 2. If you need anything, hit me up. Let me know. Okay, guys, listen, have a wonderful day. Be safe. Stay safe. Type QBank for access. And I'll see you guys sometime this week. Ciao.